people think varicose veins are simply a cosmetic issue, but truth is they can be a sign of a much more serious condition. Doctors Mark McQuaid and Andrew Skinjaleski join us this morning with McQuaid Vein Care and South Lake Vein Care with the truth about varicose veins. Good morning. So nice to see you this morning.
Hi, Jane.
A lot of people want to know about this, so tell everyone what exactly varicose veins are.
Well, the truth is the job of our veins is to bring blood back to the heart through the veins in our legs. We have little valves that are supposed to be operating in one direction to keep the blood moving against gravity. When these valves fail, we develop bulging veins, and those are varicose veins.
Okay, that's interesting. I did not know that. Okay, so Dr. Skinjaleski, varicose veins can be genetic. I did not know that either. What are the risk factors?
Other risk factors, certainly family history is a big one. There are other risk factors that do contribute as well. Age, obesity, history of multiple pregnancies, trauma, surgery, engaging activities where you sit or stand for prolonged amounts of time can certainly contribute as well. Gender plays a role in that women will present early on, mostly as a result of hormonal fluctuations in pregnancies. However, with time, men typically catch up with women in terms of their risk in terms of developing varicose veins.
So what are the symptoms besides the appearance of bulging veins?
The chronic venous insufficiency, which is the underlying process that leads to spider veins and varicose veins, can also present with some less obvious signs and symptoms. These include pain, swollen legs, restless legs, aching, heaviness, itching and burning in the legs. In severe cases or more advanced cases, people can have skin changes in the lower parts of their legs. That's basically a marker of unhealthy tissue. Unhealthy tissue being more prone to infections, ulcerations, the kind of things that we're trying to help our patients avoid by doing these procedures. The one thing I wanted to mention was that patients do not necessarily have to have spider veins or varicose veins on the surface to have underlying vein issues. They really help us to make the diagnosis a lot easier, but they don't necessarily have to be there.
So your center treats them. What are the treatment options?
We do, and the first step in treating is always to do a physical exam on the patient by somebody who knows about veins and an ultrasound test, and we do that in our office. We do everything in the vein care suites that we have in Frisco and in South Lake. And the options are to use small heated catheters, little tubes to put inside of veins under ultrasound guidance and shut them down with heat. We can inject medication into veins to shut them down, either under ultrasound guidance or just visually. And we take veins out if we need to, if we think that the patient's going to get a better aesthetic result. So we always pay a lot of attention to that as well. We also have a new treatment option available recently that is exciting, and it involves basically medical adhesives. So under ultrasound guidance, we place a medical glue into a vein to seal it. And we're really excited about that as well. We're the first ones to do that in Frisco and in South Lake.
It's amazing what technology and doctors can do these days. So what else, anything else that folks need to know about varicose veins?
Well, just if you have those types of problems in your legs, aching, heaviness, tiredness, fatigue, visible veins, spider veins, varicose veins, come on by and let us take a look, and we can really help you.
All right, and even if you don't have the appearance of anything, if you have any of those other symptoms, it would probably be worth coming by and getting some kind of a diagnosis.
Exactly. It's easy to do with an ultrasound test.
All right, thank you very much for being here this
Thanks
morning.
for having us.
Appreciate it. McQuaid Vein Care is in Frisco, and South Lake Vein Care is in South Lake. Give them a call at 972-378-5347 or head to the website, McQuaidVein.com or SouthlakeVeinCare.com.